psychosocial aspects of getting diagnosed as a child versus as, I guess, a late adolescent, 18, teenager. But so if y'all have any questions, I didn't really have like specific things prepared, but
yeah.
Okay,
I mean,
let's
I can kind of
start
generally
this
talk about.
introduction. I don't think he recorded that.
Do you want to stop?
Oh.
He's already
Okay.
recording.
Okay, start. Okay.
Hi, I'm Trick Leffler. I have type 1 diabetes. I was diagnosed when I was 12.
hi, I'm Becca. I was diagnosed when I was 18.
So I've actually worked with, I volunteer a lot at Camp Kudzu, which is a summer camp for type 1 diabetic children. So I've seen kind of anyone from age 4 to 18 and have some experience with kind of the things that go along with that. But I think at least I was diagnosed when I was 12. So one of the weird things is at that age, mostly the initial diagnosis mostly affects the parents because it's kind of like the parents see their kid. There's usually some kind of hospitalization involved. So to them, it looks like their kid is dying, and diabetes has a lot of scary history of, oh, you're going to go blind, your foot's going to cut off, you're going to die at, I don't know, 40 or whenever. But theoretically, the current, I guess, state of the art is you can live a full, healthy life if you manage to have good blood sugar control, which is a lot easier to say than do.
Yeah.
So like when I was first diagnosed, it kind of presents as this kind of progressive, you feel kind of like you have the flu and you're just kind of sick and run down. And then I kind of got to an extreme point where I was hospitalized because I was in severe DKA. My blood pH was like 7.04. My blood sugar was like 1680. I looked like I had come from a concentration camp because I'd lost like 30, 40 pounds in a couple days. So when they finally started replacing my blood volume and got my blood sugar down, I felt fantastic. I was hopping up and down on the hospital bed because it was like, I don't feel like throwing up every 10 minutes. And just they're like, think of like the worst flu sickness you've ever had and then have it go completely away like pretty much instantly. So it was kind of a swap. So I didn't really care that it was like, oh, I have diabetes and you have to take insulin for the rest of your life. It was like, okay, I feel better. Like, I don't really care. But I think it hit my parents a lot harder than it hit me initially. It also does hit different people differently depending on where they are in life. But
Mine was a week before college started, so that was a little difficult. It was kind of, I got diagnosed and then instantly moved away from home with a disease I knew nothing about, because at the time I was like, maybe I have type 2 diabetes, that would be so much better, but I didn't really know the difference between the two. Mine was a little more, I kind of did the denial thing of, well, if I ignore this, it'll just go away, because again, I didn't really know much about the disease. Some people told me like, oh, I've heard it just goes away on its own if you do everything right. Again, that's more like type 2,
yeah,
not
there's
like
a
type
lot
1.
of there's a lot of confusion and misconceptions. Type 1 and type 2 are very, very different diseases. They just have the same name because they have similar symptoms.
Honey urine.
Yeah, honey urine. But kind of the treatment and management are worlds apart from type 1 and type 2 and how it affects your life. Most notably is type 1s there's no fixing or reversing type 1 diabetes. You have diabetes forever and you typically get it when you're young and you have it till you die. So type 1's more of a cumulative every day, every hour for when you're awake, when you're asleep. Things can go wrong.
Which is difficult when you've gone pretty much your whole life not really worrying about what you eat or, exercising, what you're doing, and then suddenly it's like, okay, I eat this little thing, I need to count all these carbs. It's a transition that took me a while. I still don't really have it totally under control, to be honest.
I still don't either. I remember eating.
Yeah,
it's probably the weirdest thing is I think people don't realize how often they put things in their mouth.
Yeah, like
and
a lot of the times I actually forget that I even have type 1. I mean,
except when stuff goes wrong.
Right, and when it's like, oh crap, my blood sugar is high, I need to take some insulin. But My symptoms were I'd been working out a lot for cross country, so I didn't notice really the weight loss right at first. It was more the thirst. You've never felt more just like I'm stranded in the desert. I need an oasis with water in your life.
Yeah.
Like I'd be in the car, we'd take a 10-minute drive somewhere, and I would have to stop at a gas station 3 times to get an extra thing of water
And
use
go to the bathroom.
Yeah.
Yeah. I was in 6th grade and had to go chug water for the whole 5-10 minute break between classes, go to the bathroom, go drink some more water, go back to class, halfway through class, go out. And I just kind of thought it was part of like becoming an adult, where it was like, oh, you just start drinking water, because I was like, oh, my urine's clear, like that's healthy, like woohoo. But didn't
like,
realize till a week later when I was in the emergency room that
Yeah.
that was probably bad.
Mine was like, well, I'm working out a lot and drinking a lot of water. This seems excessive, but maybe it's normal. But it started getting to the point where I couldn't even get a decent night's sleep because I was waking up like 8 times in the middle of the night just going and drinking water out of the sink.
I started wetting the bed again at 12.
Oh, I didn't get that bad.
Which, I mean, it was, sometimes I would wake up and then other times I would have dreams where I was swimming, or I had dreams where I was in my own bathroom and I would wake up and I wasn't in my bathroom, and that was distressing. But
can I ask you guys, so how did you finally, like, at first it's like, oh, maybe this is just normal. What was the thing that your parents or you realized because you were a little bit older?
Mine, just how much I was having to use the restroom. I finally started tasting and smelling a weird taste, which at the time I had no idea what it was, but it was the acetone. And then I did start dropping a lot of weight probably after a week of the constantly having to drink and use the restroom. I probably dropped about 20 pounds and I was already pretty thin. So that's when I was like, okay, this isn't normal. We need to go somewhere. So I went to my doctor. They did a quick blood test. Saw that my blood sugar was off the charts. It wouldn't even read it on the machine they had. So then I went to the hospital. They did more thorough tests, and that was that. But, so yeah, and then I got training and went to college, and then kind of ignored the training, thinking diabetes would just go away because
it's really a strange like crash course. Typically you stay in a hospital and you have we had like 3 days where they teach you like how to check your blood sugar. They teach you how to drop insulin and take insulin, like all the sites that you can take it, all the site rotation.
Which, I'm terrified of needles, so that was probably my biggest concern.
Actually more common than you would think in
I was like, oh
population.
No.
And like I was 12 at the time, but I was able to handle it, so I kind of decided then that it was like I was going to do everything, because my mom was really bad at giving an injection. She gave me 1 injection, and that was it. And then my dad would do it, but he would take like 45 minutes to do anything, so I got fed up with it. But you see, I think in younger kids it's really strange because you can't really explain to a 4 or 5-year-old things in terms of like 5 years from now or for the rest of your life or all the time. And they also seem to like forget that they have diabetes. Like if you ask them if they had diabetes, they'd say yes, but they don't take it into account for anything they do. So I did a day camp with 4 to 8-year-olds, and we had lunch, and giving insulin at lunch was like a big event because some of the kids wouldn't want to check their blood sugar, which is not too distressing. Some of it, I mean, it hurts, but it's
I like doing
quick.
it right here because it hurts a little less. It's not quite as accurate, but it's pretty close. So.
Yeah, I use like 2 of my fingers until calluses show up. But giving insulin to a 5-year-old who just he doesn't want to get stabbed with insulin that burns. He just wants to go eat his lunch, and you kind of trying to reason with them and saying like, oh, well, if we don't do this, you're going to feel bad later. They don't care about later. Later is not a concept. So, but then you finally get it into them, and then they go and they're happy and they're running along.
Can I ask another question?
Yes.
Yeah. You have a pump, right?
I do.
When did you decide to when did that happen?
So there's different modes of operation. Some endocrinologists try and get their kids on pumps as early as they can within 4 or 5 months. My endocrinologist has a strong belief that you should go without a pump for a year, and the main reason behind that is to get good with all the mechanics of doing diabetes, because you still have to figure out how much you need to take and when to take it and how to take it and what effects. So like a pump it's kind of a crutch. It doesn't do anything automatically. You still have to count your carbohydrates. You still have to check your blood sugar. You still have to figure out how much you're going to take, and you have to remember to take it. The only difference is instead of drawing up a syringe and injecting it, I just dial it up and press OK, and it injects.
And there are two different types of insulin. There's one that you take at night that's long-term acting, and one that you take just with meals. And the pump, it's just the short acting, since it's constantly giving it to
You get a
you.
little infusion.
So if you have a problem with your pump, your blood sugar can spike really quickly because you're not on that long-term insulin.
Yeah.
That's kind of what happened to me when I'm on insulin pins. I guess I can show what those
Yeah.
look like.
So the major differences between the two therapies the cons is with multiple daily injections, you have to remember to carry everything with you. You have to dial it up and take it. The advantage with that is you have 24 hours of insulin. So as long as you get your Lantus or Levemir, the nighttime insulin, you probably won't go into DK for the next 24 hours. Whereas my pump,
depending on how much you're taking, but
yeah. So with my pump, if it breaks or the insulin gets too hot or I unplug it or it gets disconnected or 1,000 other things that can go wrong, I can be in DK in 4 hours. And it sneaks up on you, and there's a delay. So even if I notice that my pump is broken and I know it's only been broken for 30 minutes, I have a window of an hour. Well, once you inject insulin, it takes 30 minutes to start working, and it doesn't peak for 90 minutes. So there's a delay, and you're always chasing because you don't have direct access to your blood sugar control.
And I mean, people that have it normally acting, you actually start secreting insulin right, like before you actually eat.
The whole cephalic phase of digestion, you guys...
we don't have that.
Yeah, if we brought a plate of cake out here, you guys would all smell it and see it and secrete some insulin, because if you decide not to eat the cake, you can stop secreting insulin and you'll be fine.
And then use glucagon if you go low.
Yeah, and for us, ideally you take the insulin 30 minutes before you eat, and then if you don't eat, the insulin's still going to hit.
Yeah.
And
so you always have to make sure if you take insulin for something. I do this a lot. Like I'll eat and I'll be like, oh, I'm full. Okay, I'm not going to eat the rest of this. And you just took insulin for that whole meal, so you have to still eat something or drink something, or else you're going to go low, and then that makes you feel dizzy and slightly drunk, and it's
none of the fun.
No,
yay, I'm
like
warm and fuzzy drunk. It's like
move.
I can't walk straight and think and talk.
Like it's like a severe adrenaline rush to begin with.
So as a result of that, there's kind of a natural tendency to just eat and then take the insulin, which doesn't work as well because your blood sugar spikes before your insulin spikes. So you get yelled at by your endocrinologist when you do that.
Yeah. Because then they check your blood sugars and they're all over the place.
Yeah, and your A1C. There's a lot of stress. I had a good endocrinologist, so I didn't mind going to see my doctor to get so you have a bunch of ratios, and like your nighttime insulin amount can all be adjusted.
And your monitor, it records all of your blood sugars, and they can just hook that up to a computer and see what they've all been.
And they go, well, why on February 12th at 1 a.m. were you 350? And you go, which 350 was that? Was that Monday night or Tuesday night? It was like either my insulin went bad or I ate too much, and you're like...
Yeah, it's very... I hate going to the endocrinologist.
It's a big black box of
My endocrinologist in Atlanta is he's pretty good about it. Like, he's very understanding. Some of his PAs are a little more stressful to be around. But yeah, you get blackballed pretty...
Yeah, and you have to see them every 3 months or they stop writing your prescriptions, and then you don't have insulin, and then you end up in a hospital, which isn't fun. But...
And then on the other side of that, like with the night shot with the pins, like I was talking about, if you take too much of that, what can happen is when you're asleep, your blood sugar can go really low, and then you won't wake up, which has happened to me. And then you go into
or you wake up all the time
seizure,
and you don't sleep.
Or that happens a lot too. So.
What about during exams when you are stressed out? So cortisol is high, therefore
you get this nice spike.
I honestly...
Do you adjust your insulin during that time?
I don't. I used to, and I would find myself over adjusting and going actually low during tests, which
Yeah.
is really
It's also
bad because your brain starts
transitionary.
shutting down.
So you get so in high stress situations like tests, or I don't know, you get in a car wreck or something, your liver will release a big surge of glucose. So you'll see your blood sugar spike up to like 200 or 300. But with that, it's a little different from when you eat and your blood sugar goes up that high, because even though you're 300 from the food, you're actually still getting more sugar in. So it's kind of a sustained peak, whereas when you're stressed, it'll go up to 300, but then it'll drop. So typically, I personally don't treat it very much. I mean, if it gets up to 350 and I feel bad, I'll take a half unit, which is almost nothing for us.
I never
But
take half units. I don't think I even can
yeah,
with insulin pens.
yeah, depends. Some of them you can.
I typically try not to overcorrect, because when I overcorrect. It usually just ends up going low.
There's two modes of living with diabetes. You can either have really good control, which is what your doctor wants, and you have hypoglycemia 4 or 5 times a day.
It's very difficult to
which
keep it
is
at a baseline.
You can't. I mean, my brain stops functioning. I can't think or make words. So if I go low during a test, it's like I went to the bathroom and didn't come back, or I was taking shots earlier and now I'm drunk and trying to answer
I just
test
kind of blankly
questions.
stare like.
And then the other side is you can function, but your blood sugar is 200 or 300, which causes long-term damage, which your doctor doesn't like and you don't like, and causes problems down the road.
Problems right now versus problems later.
Yeah.
And again, I mean, it's just very difficult to keep a baseline. There are so many things changing throughout the day, depending on what you're eating, what you're doing, if you're stressed, if you're working out. So
There's
it's
a lot of
usually
critical
with mine, like, I'll be low, then I'll go high, then it's just constantly correcting for the highs. So
You're always chasing something. And you guys have probably noticed that there's a lot of factors and a lot of math and thinking. It's basic math, but there's so many things to consider. We haven't even talked about exercise or even alcohol, which is something older
alcohol's a
people have to
whole
deal with.
nother- Yeah. That was
but
fun in college.
Lots of critical thinking that, I feel like the kids I've worked with are a little, the day camp I worked at, there were also non-diabetic campers there, and our kids had a little more like forethought and like had a little more awareness, I guess, and critical thinking, and just able to like anticipate things slightly better than. That's kind of anecdotal, but it's just a part of your life, is always considering them. Do you get test or like trip anxiety, like traveling?
Oh, so then I'm not having to stop every few
Yeah.
minutes to go to the bathroom?
Yeah, and I hate packing. I love to travel, but I hate
all
packing
the
to travel
medicines and things.
because you have to have
Yeah.
all the contingency plans and.
Yeah, I've got like a bajillion bags of medicine, and yeah.
And then there's always the parents that.
Oh, if you don't answer, then you're dead.
Yeah, there's a lot of looming parents for.
My freshman year, I
everyone.
had my mom call the TA on me more times than you would believe, because I'd be sleeping and I didn't answer my phone, so automatically I'm in hypoglycemia and I'm dead.
There were several weekends where my neighbor from 3 doors down would wake me up. He would be in my room, like poking me and be like, "Are you okay?" And I'd be like, I just wanted to sleep in till 11.
Yeah. But on a serious note, I mean, alcohol, that's one thing in college especially. That is dangerous because it ups your blood sugar a lot. I mean, it'll spike with whatever you're drinking. And then it tends to crash in the night. So that's another way you can go low and then not wake up. My endocrinologist had me on a really big dose of long-term shot to begin with. So my hypoglycemia in the night it's very weird. I was talking to my mom and I was like, it's like I get stuck in dreams and can't wake up. I'm not sure what's going on. And it really is. It's almost like, what are those realistic dreams people talk about?
Dreaming?
Yeah, it's sort of like lucid dreaming almost.
Yeah.
But I would just be like talking away to people, not even knowing it, because I'm asleep and I'm still talking and acting things out. It's very strange.
Yeah.
But anyway, then you can't wake up. People will try to give you something sugary or a glucagon shot, and typically people get very violent, diabetics too, when they're that low.
Yeah, you can get there's like 10 different kinds of low blood sugars. There's the ones where you don't even feel it and you just check and you're low and you're like, okay.
Passed
And
out.
then there's the other ones where you're unconscious basically,
Yeah.
and you you combative and
Because mine, I'd be stuck in a dream in my own head, and in my dream, meanwhile, my dad's trying to give me a glucagon shot or something, but in my dream, it's like, oh my god, there's this murderer coming at me, like, I must fight. So,
you get out of
if
it.
you ever
And then
have
you
to
come
treat
back
a
to it, and then
diabetic
like 10
that's-
minutes later, you're like a normal person again.
yeah.
And you're like, I'm sorry.
But if
I
you
was
ever need to
weird,
treat a
and-
diabetic that is passed out with glucagon or something, don't
Get some
come at them like aggressively. Just try and talk soothingly to them. Like, don't try and hold them down. Don't try and fight them. Like, just be soothing. Be nice to them.
Another weird.
That works better for me anyway.
Could I ask you if you could comment on obstacles to adherence based on your own experience
Everything.
and your experience
Yeah.
from working in camp? with
I think one of the big
different
things-
different age kids.
Yeah, I think one of the big things is everyone's diabetes is different. There isn't the best we have is you have a long-term acting insulin or a basal rate amount that's based on basically your size and your metabolic level. Mine is 50 units a day, or actually it's 55 units a day.
Mine
much do you
started
take?
out at 64 and now I'm on 35.
Yeah.
It goes all over the place. I mean, it also depends on your thyroid, how that's going.
Yeah, we can
And mine's
get those like
hypo, hyper, who knows.
Yeah.
So
So like if I stop exercising, my requirements go up towards 70 units, and it's like a daily thing. So if I run today, the rest of today and tomorrow, I'll require about 50% less insulin, which is something to just remember, or you'll go low and have a seizure. But then you have a insulin to carb ratio, which is mostly dependent on the balance of, or I guess the fraction of calories that come from carbohydrates in your meals. So if you eat a lot of high fat, high protein meals, you'll have a higher carb ratio, whereas if you eat basically pure starch, you'll have a lower one. Just that's how it works out. And then you have a sensitivity factor, which is 1 unit of insulin lowers your blood sugar by X amount. And so each person has these things.
too.
And you also, those factors change at different times in the day. So mine's constant throughout, but some people have like a 1 to 10 ratio in the morning, and then they have a 1 to 50 at night.
Mine, I've changed it up that way.
Yeah,
too.
and you change it depending on what you're eating and when you're eating and how. So
When you're more metabolically active.
there's a lot of variability, and that's working with the best education of someone who fully, like Beck and I, probably are near the upper end of understanding of how the whole disease works.
I do feel though that if you get diagnosed younger, just from what I've seen, you're probably more in the habit of doing those things. Whereas with me, I mean, counting what I'm eating every time I'm eating, I wasn't really in the habit of doing that. So I'm still not very good at doing that.
think there's a
I find
trade-off,
myself kind
actually.
of just eating the same thing every day, so that I don't have to do that.
There's a trade-off because you have people who were diagnosed earlier are more habitual in taking some insulin, but they're a little less dynamic. They always take 10 units of insulin because when they were growing up, their mom told them to take 10 units, and it's more of a monkey see, monkey do.
And when does it transition? If there is a typical transition, when does it move from parents being responsible for setting up? I'm sure that
It's
that's-
around.
no,
It's
no,
around. It
no.
depends a
No,
lot
no,
on
no,
the
but-
kid and the parent
Right.
and how attached the parent is to controlling their kid's diabetes. There's a lot of factors, but generally, we try and encourage around the time of puberty, especially high school age when you're getting ready to go to college, because typically your parents don't follow you to college.
I would also think around 15, 16, driving, not being around the house as much. So you're
Yeah.
out with friends, eating without your parents right there.
And what forces in the natural social environment of growing up collide with that?
I mean, it can be embarrassing if you're like, oh, wait a second, guys, let me get my shot out and give my insulin, because then people are like, what are you doing?
Yeah.
Are you
There's
are you
also
taking drugs?
Yeah,
Like,
and there's a lot of, I guess the best word is like shame. Some people are very, like, I'm probably the most open person you will ever meet about my diabetes. I will talk to you
I'm not
for
quite as
days,
much,
like I'm doing
so-
now. And then there are some people who you would never, ever, ever know they have diabetes at all. They'll go to the bathroom.
that's more
They'll
me.
they just go to the
I'm just
restroom
more
and do everything
discreet about
there,
it. I
or they're
just
discreet.
give
Yeah.
shots through my Vikings.
And if someone's like, "Oh, what are you doing?" You're like, "Oh, I just taking some medicine."
Like, I'll
and leave
talk
it at
about
that.
it. I just don't really wave my insulin around in the air, and yeah.
And there's a whole lot of, I guess, negative feelings because if you have bad control, you never go to the endocrinologist and they're like, "You're doing a terrible job," and you're like, "Oh, really? I thought it was perfect." You know because you're living with it every day. It never gets outside of you. So there's kind of a negative feedback of you have bad control and you get yelled at it, and then you don't want to do it. I have a weird thing where if either of my parents asks me what my blood sugar is, I will immediately make up a number that's between 100 and 180, or between 300 and 400, depending on if I want sympathy or something. And then I will not check my blood sugar for several hours, no matter what. Even if I was just about to,
I do almost the exact same thing. I just get aggravated when it's like, "What's your blood sugar? What's your blood sugar?"
Yeah, it's like, you don't know.
My blood sugar's fine. Leave me alone. I'm just gonna tell you something so that you don't bother me anymore about it. Or sometimes if I'm just hungry and being a little disgusting that day and my mom's lecturing, I'll be like, "My blood sugar's low. I need to eat, Mom."
Yeah. That's why I need these Snickers bars.
Yes.
Can I ask a question?
Yes.
I might just not be understanding how it works, but when you eat, do you anticipate, you're like, okay, I'm going to eat a sandwich, there's going to be that many carbs, therefore I'm going to take this much insulin. Is that how it
That's how it
usually
works.
Yeah.
Okay, so say like if you're planning on like a night out or something, you're going to be like, okay, I'm going to drink 8 beers. I know it's a lot, but like let's say like 8 beers, and then like I'm going to take this much insulin.
Yeah, alcohol is another big social is a big psychosocial, because it's a social issue for everyone,
Right.
and then we have kind of a unique set where I mean, if you guys have seen me, some nights I just won't drink because I could, but it's not worth the effort to me.
Right.
Or I haven't prepared. Diabetics have to eat. Generally, you can get around some of these things, but generally you have to have some kind of food to keep your blood sugar up, because alcohol turns off your liver, so you don't get any glucose. You have to reduce your insulin, which I can do. Like 2 hours before, I can tell my pump to give me 50% less insulin.
I can't really turn down my night shot once it's been.
Yeah.
If I haven't taken it
do.
yet, I can take a last night shot. But if I've already taken it, that's done until 24 hours later. So.
And then, depending on how much you drink and how quickly you drink,
Not to mention
can
when you're
do all kinds of
drinking,
things.
sometimes you're not paying as much attention to what you're taking.
Right.
And you also
I've had before where I've taken my night shot twice because I had taken it earlier that day, forgotten about it while drinking, taken it again, and then your blood sugar is bottoming out all night.
Wow.
So that's.
Or you start running
That-
around.
That kind of
exerting
leads
yourself.
into, I think, a really, really, really important
Yeah,
question.
and that's actually a big part
in
of.
youth and teenagers and so forth. Peer influences are so important. And
Yeah.
I'm seeing you guys as being two extremely bright individuals who perhaps are maybe a little bit more, not resistant, but that can maybe handle it better than a lot of the majority of folks. And I may be
There's a lot of.
glossing over that a little bit. I don't know, but
And it also depends on the day. Someday,
how
I generally have a very
Some day I'm
positive.
just
I
like,
guess-
I don't
guess
feel like dealing
the
with
question
it.
that becomes really crucial is how understanding are peers, and maybe it's at different ages.
Okay, well, I would say very understanding, but that being said, my peer group is y'all, and I was diagnosed at an older age, so people, kids can be mean, I'm sure.
The first,
being
I
younger.
remember when I got back, I got diagnosed the next to last week of 6th grade, and then I came back for the last week, and I actually couldn't, my blood sugar had been high enough, long enough that my lenses had swollen in my eyes, so I had to wear my dad's glasses to see anything. That went away. That's very transitionary. But I was wearing my dad's glasses, and I remember walking into my homeroom the first day, and they were like, "Oh, where you been? We're glad you're back." And I was like, "Oh, I just was diagnosed with diabetes," and I went, and everyone flinched and went back, and I was just messing with them, but it was fun for me. But
That's another thing,
I kind of
also find
elicited that response.
Since the population doesn't tend to know sometimes the difference between type 1 and type 2, sometimes I don't want to talk about it because I just don't feel like hearing oh, you have diabetes, like you need to go work out and eat better. And it's just
Yeah,
like,
probably everyone in this room has a family member or a neighbor or their aunt or their sister or their sister's boyfriend. They have a like 1 or 2 second degree connection to someone who has diabetes. The vast majority of the cases are type 2. In addition to everyone knowing a diabetic, not everyone, but lots of people know a way to fix diabetes.
yeah, my grandma sends me articles in the mail like every week. I'm just like, okay, yes, I will eat better and exercise.
I think
Grandma, fix it.
the best ones I think have been cinnamon. Cinnamon has a small increase in your insulin sensitivity, which I mean is nice for us, I guess, if you want to take cinnamon all the time. But
I mean,
we don't make
anymore,
insulin, so it doesn't fix anything.
But-
Okra water is, I think, one of the latest ones.
Okra water.
Yeah, I'm not exactly sure, but I think you soak okra in water and then you drink the water, and
yeah. Anyway, it gets
that fixes
frustrating.
it. So yeah, and hearing the same things over and over
Yeah,
again.
you just kind of turn your mind off to it, and
Yeah.
that's one reason I just don't really like talking about it with people that don't know the difference, because it's just frustrating. And
You've explained it
Yeah.
hundreds of times.
Is
and
there anything that like
it doesn't get through.
you think back to when you were first diagnosed? You're like, now you're like, man, I wish I had kind of realized that then, or like earlier on. Like, is there anything like you come to realize, or
that it's not going to go away if I ignore it.
I think the biggest thing for me was there are some diabetics who are very neurotic, and they devote 70% of their time on this earth to managing their blood sugar, and they have moderately better control than I do. But for me, I would I guess run a little looser, and it's a balance between having perfect control and being able to live my life a little bit in very broad terms. So choosing to, I don't know, there are days where I go, I'm not checking my blood sugar for the next 6 hours. Like it's close enough. I'm not going to die from it today.
You
I
generally
have
can't
other things to
tell
deal with.
kind of where your blood sugar's at too.
Yeah.
You just know.
And you can feel like when it falls or when you're high, you kind of
You
have
know
something
how
in the
you
back of your head
act,
kind of
too.
monitoring the whole time.
Like I act differently depending on where my blood sugar is, and I
Yeah.
can usually be like,
It'll still
"Oh,
sneak up on you though.
Yeah.
But I always think of low blood sugars as there's someone like sneaking behind you with a big syringe of ethanol, and they just kind of hit you with it, and then 20 minutes later you're just like, I can't pick
I'm
up
just laying on
a
the floor
thing.
sweating, just like,
Yeah,
"Oh,
the sweaty lows are the worst.
I always
Well,
get sweaty
second
lows.
worst. The worst ones are the headache migraine ones, which
That
I
usually
have
follows
another
the
time.
sweat.
It's just, but
Or if
Do
you
they
go
still
really low, it feels like a hangover the next day, which is awful.
yeah.
do you ever still have like big serious things happen often, or
Yeah,
like once a year?
I would say once a year. There's just so many factors that you have to juggle that eventually they're all going to hit in the air and fall to the ground, and you have to go to the emergency room.
One big one, we talked about how autoimmune diseases kind of tend to run in pairs. Well, not pairs, but the more you have, the more you're going to get. One of the medications that's constantly used to treat autoimmune disorders are glucocorticoids, like cortisol. That ups your blood sugar a lot.
Yeah,
so like, if
steroids.
you've got type 1 and other stuff like I do, you have to really, if you have patients that are doing this, monitor their blood sugar. Gosh, for a while I was talking to my endocrinologist on the phone every day because they were trying to lower the cortisol slowly, because you can't just drop off of it or you'll have inflammation everywhere. So that's something that you definitely
Yeah, I
have to
got
consider.
put on an asthma steroid, and I called my endocrinologist because I had been 400 for 2 weeks straight. I literally was taking more and more insulin, and I was up to, I don't know,
Just
billion
not going
units a
down at
day,
all.
and it just nothing did anything. He was like, "Are you on any medications?" I was like, "Oh yeah, Advair and Flonase." And he was like, "Stop taking those. Just stop. You can't. I mean, I guess you could take them, but you
You
need
can.
like this much insulin,
Yeah, it's
which is expensive.
frustrating.
Which is another issue that comes up. Diabetes is very expensive.
Even with insurance, it's
Yeah.
ridiculous.
There's different grades. Kind of the cheapest way to do insulin, you would have, well, I guess the cheapest would be you would have a regular insulin, which they use in type 2s who just
the
need a little bit.
syringe insulin.
Yeah. I guess
Yeah,
the
the
cheapest
little
end of type 1 would be you would get a vial of
Yeah.
insulin, which we probably
Most.
And then you would have syringes, and the syringes are crappy because you have to draw them up,
Yeah.
and they're not as sharp.
And they're a lot. The diameter's a lot bigger, so that is kind of painful. Like I've got tiny little baby needles on my insulin pens.
They're like 21 gauge needles, and pen needles is a vial of insulin. So that's 10 milliliters of insulin, which costs about $80 or $90.
Have you ever dropped one or broken
Which
it?
no, I had a
That's
6-month
conscious
supply
ones,
fall out of
so-
the fridge where I kept it onto concrete, and they just shattered.
Wait, how long
And
is
then
that?
replaced
Or
it.
if they get too
This lasts me
hot.
like a week or 2 weeks.
Oh, and one of the most
a
frustrating
lot.
things of these pins sometimes get jammed. And they
Yeah,
won't work
and then they're
anymore.
just useless.
So then it's just okay. That's down the toilet.
So how much does a pen cost?
So pens are more expensive than vial and
Usually about, like,
syringe.
120.
Yeah, you need a pen. You need pen caps, the pen needles, which is this
Yeah,
thing.
they're all very expensive. Then you need lancets to actually do your blood sugar, and then you need strips to test it.
Are the pens like a one-time use? Like I'm confused. Like
They're
how-
supposed
Most of them
to
are.
be,
Most of them are one-use cartridges. Some of them have replaceable
They're
cartridges.
supposed to change them
They're
every
about
time.
the same cost.
I am lazy, so I don't usually.
Oh
but
yeah, the
these
pen
really-
needles are supposed to be one-time use, but also the vial.
With
the
these
insulin
really
itself
tiny
is-
needles, though, if you use them too many times, they'll actually like bend and the insulin
Right,
won't go
right.
through, so you have to change them. But
You are
So, I mean,
still
you
on
can-
your parents' insurance, correct?
Yes.
no,
Oh, you
it
weren't.
just ended. So well, it ended.
Oh, you just. Oh, you're.
Yeah.
old.
So,
Oh,
how does
If
Thank
you,
you.
if you need
Really
it, instead I
how
have-
does Affordable Care Act influence your choice of insurance and also the cost of your insurance?
I don't really know
don't know
because
either.
I've been on my mom's insurance. Now I'm on GRU's or about to be.
Yeah, and we can only go here to be covered, right?
That's going to be difficult because I have
But-
so many specialists, and I have to get referrals for every one of my specialists for GRU's insurance to pay for it. So this is about to be a very large time commitment with lots of extra bills for going to different doctors to get referrals to go to other doctors.
Well, ACA prohibits you to be discriminated against because of your
Well, there's a difference
existing
between
condition.
discrimination and what they will pay for. Technically, all your insurance will have to pay for is a vial of short acting and a vial of long acting, because you can achieve theoretically 100% control, which is complete
Like-
bullshit.
These
You can
pins,
never get
I don't
that.
have to have these. These are easier to use. The vials
Yeah.
would be cheaper.
And you don't even take into account how we haven't even started talking about insulin pumps, but
Yeah, the insulin
the
pump
ease
itself
of care
very
is a
expensive.
large portion to compliance, at least in my personal opinion.
Yeah.
If it's harder to use, I'm not going to do it. And
If I had to get my vial
But-
out every time I ate, take it up in a syringe around with people around staring, I wouldn't take it nearly as much rather
Yeah.
than with this. I just,
that takes
Done.
maybe 8-10 seconds to do.
Yeah.
Would
Drawing a
you
vial up
dispose
is.
of your needles.
Um,
I know I was at a farmer's
you
market a little bit and
actually-
we didn't take needles.
You can
and
throw.
sometimes
Most
we
of them are
ask us.
self-contained. That you
most
can
of
throw
them,
away.
these are self-contained. I used to, if I was like in the
I have a Powerade
dorms
bottle.
in college where I didn't want to be throwing these in a trash can and having people possibly stab themselves. I put them in water bottles, empty water bottles, and then
Or
just screw 'em
bleach
up.
bottles or laundry. You just
Yeah, just something that you can
stack it up
close.
and then you throw that in the trash. You can buy Sharps containers at Walgreens
Yeah.
or CVS or whatever. But yeah, so you have that's a level of expense, and then you get into insulin pumps. I just got a new one actually. So this is an insulin pump. There's a cartridge inside that there's a little. This is insulin. There's a piston inside that kind of drives it. I have to carefully not give myself insulin, which infuses it down. Yeah, you're not supposed to do that, but it's okay. It infuses into your skin. This
Is there a needle?
there-
in
Is
there a
there?
plug or
there's a plastic cannula that's about 6 millimeters long. I should have put it. If I had known, I would have put it in a new space. But you have to
It's-
change those. So the pump itself can range depending on the pump and what your insurance will pay, from like $2,000 to $8,000 out of pocket. Usually, when you buy it, you get it for 4 years. If it breaks, they send you a new one. They take care of you for the most part. Supplies, you have to get disposable cartridges, disposable insulin sites, which can run a couple $1,000s a month, depending on your insurance.
Out of pocket.
Out of pocket, depending on the copay. My insurance works very well. I'm still on my parents' insurance. We each year my family pays we pay 100% up to $5,000, and then they theoretically cover everything from there. We usually max out the $5,000 by April at the latest, if depending on the supplies that I have stockpiled.
Camp that you volunteer at, do you see differences in like? Well, I don't know if the camp costs money, so it might be that there's more affluent people there. But do you see some kids that are coming from less?
We have kids who come and
affluent
it's the only time they get insulin. They reliably get insulin.
Wow.
During the first couple days, a lot of the kids, we will transition from syringes and vials to pens, just because it's more convenient for the clinicians at camp, and also it's cool and convenient, and it's cool for kids to get to try new things. At camp, a big part of the camp is education. So we have these things called Golden Syringe Awards, where if like the first time giving, especially for the little kids, it's really cool that it's the first time they give an injection by themselves, which is like, oh, cool, like that's hard to do an injection. But when you think about it, like now that they can give their own injection, they're like that much less dependent on their parents, and they're going to be giving injections for the rest of their life. So it's kind of like the next step in becoming an adult diabetic, I guess.
And a lot of endocrinologists do, at least mine, if he has patients that aren't as affluent and do have more trouble actually paying for it, they give samples out a lot.
Yeah, we get a lot of insulin donated, and we can't keep it after the summer. So a lot of kids will go home and there'll be a couple extra boxes of Lantus or Epidra.
They do expire, or if they're exposed
or
to
the
heat.
volunteers, actually, especially like that's one of the big events is transitioning from your parents' insurance to your own insurance, because there's a lot of gap between. So a lot of endocrinologists will they'll time everything so that you get a 3-month supply or a 9-month supply. You can't usually get 9 months, like a 6-month supply of everything, like the last month, so that it'll tide you over.
Yeah.
Was there a psychologist in the camp?
We have child life specialists. They generally they don't deal with diabetes issues, just because we kind of have forced a camp of we typically have 200 to 250 campers who have diabetes, and then we have about 60 or 70 staff adults who have diabetes. So generally when a kid is like, oh, well, I don't like checking on my finger, we have someone that says, well, check on your palm. And it's there's a lot of social interaction between the camps.
Can you address the issue of the emotional toll that it might have on you?
I mean, it's constant.
If any.
There's, I think the most recent emotional toll I had was I went to go to Atlanta. I think for my brother. I have a twin brother who's not diabetic; he's fraternal. But it was like our birthday, so I went to Atlanta so our family could meet. And I had taken a shower that morning, grabbed extra pump supplies in case my pump broke, grabbed an extra vial of insulin, packed all the other stuff I needed to go to Atlanta and spend the night. Got in my car, was driving about an hour and a half. I stopped for breakfast at Chick-fil-A. Forgot to take my insulin, so an hour later I was starting to feel high, so I reached down to take more insulin and realized I had left my pump on my bed at home, which was okay because I had like a vial, I had probably that vial of insulin and syringes with me, so I managed to correct for breakfast and food, but I don't have any long-acting insulin, so while I was driving I had to call my endocrinologist, who had to fax in a prescription to a Walgreens in Atlanta so I could get long-acting insulin. Got to Atlanta, the Walgreens I went to didn't have any Lantus, so I had to drive to another Walgreens, but they had Lantus, so that was fine. But I was really mad because I was right at that point where I could have either turned around and added 2 hours. I was supposed to be there at noon for lunch with my brother and his girlfriend for birthday lunch, but
This tells me that you were analytical about this issue and you solved it. You
Yes.
solved the problem you encountered.
Yeah, you
I
have to-
wonder if at any time you felt you needed counseling, someone, a professional who would listen to some of the issues you might have had.
I think for newer diagnosed people, there could be you're kind of watched a little by your endocrinologist the first. Typically, we see our endocrinologist every 3 months, depending on your needs. But when you're first diagnosed, you'll meet every month, and if you need more, you can meet every 2 weeks. And they kind of make sure the first couple times you come in, they're asking, how are you doing with carb counting? How are you doing with drawing insulin, getting insulin? Is your insurance paying for everything you need? How's your blood sugar meter working? Like very basic how to do things. And then
So those are management issues.
And then you get into kind of advanced, like, what would you do if something broke? To kind of walk
Were
through
there
that.
any
For
time
me-
mood issues that you had to address?
One thing that I kind of had problem, well, I still kind of have trouble with. I'm a very independent person. I don't like having to be attached to a medication, so that's been one emotional thing that's been very difficult. That and like your parents are naturally going to get a little more overbearing about it. Then you have all these doctors that are overbearing about it. So I do feel that for those that kind of are more independent, it can be a very difficult transition.
That's usually what we see on a referral in psychiatry.
Yeah, because it
It's
does
usually
like
a parental
like-
unit that's become overly vigilant
yeah,
and
'cause
at a developmental stage when the person wants to
Yeah.
spread their wings.
We see a lot of-
parents have a hard
Well, I
time
did
pulling back.
part of the Appalachian Trail last year, so that's one thing you have to think about. Like, okay, I'm attached to this medication. I have to get like drop points
Yeah,
where I can actually
rest
get
stops.
my medication, and it's not going to go bad in the heat. So it's
But
just a
that's
lot
also
of
very analytical. I feel like
There's a
But
lot.
it's
There's a
just
lot of analytical
knowing
thinking.
that you have to have a medication or you're going to die. I'm not,
I wouldn't be surprised if you tested kids who had grown up with diabetes or had diabetes for more than 2 or 3 years. I would say their critical thinking skills are above normal, just because you have practice every, I don't know, 2 hours. And yeah. And
So it makes them even stronger, you're saying? Do you think depression is less prevalent among children and adolescents with type 1 diabetes than in general population?
I can't say it really changed my personality or anything getting diagnosed.
But I guess
yeah.
the group also could chime in and see what you know about type 1 diabetes and mood disorders, including depression.
yeah.
I'm gonna be
I
honest.
think
it has a lot to do with the
Type 1
school.
It's
from
swinging
birth.
a lot, but
I didn't
Yeah,
realize
I actually
you
didn't
You can get
diagnosed,
diagnosed
like,
up till you're
12,
59,
18.
or I know a lady who was diagnosed when she was 49,
there are
and now she's
some-
like 80.
I did not know that.
Yeah,
I don't think it's general knowledge.
I mean,
It's
usually
typically you have a
genetic
surge around.
predisposition, and then you've got some environmental factor that triggers it.
So you get a lot of type 1 diagnosis around birth,
Puberty.
because it's a stressful time around 4 or 5 years when they start like growing, and then puberty
High
is a
stress
big
situations
one.
can trigger.
Not only physically stressing, but your social environment, and
Hormonal
high school,
changes.
and going to
Sure.
college
Also,
is
I don't
very.
know if I really understand the short acting versus long acting insulin. Like I
It's-
don't
So,
know. I thought
Yeah, so long acting insulin has a working time of technically more than 8 hours, but we typically use 24 hours. So if you take 50 units or 48 units over 24 hours, you'll get 2 units of insulin every hour, and that's to support your basal metabolic rate. So yeah, so right now
If
you're all secreting
if you're
insulin.
on the pump, you
Sure.
don't, because
So
since
you don't do it. Long
Yeah, I get short acting insulin. I get 2 hours of short acting given every hour.
this is connected, so whereas mine, like the long-term insulin is working over time, but I don't have anything attached to
Yeah.
me to be giving it.
She like
constantly.
injects it and it crystallizes and then it kind of dissolves over 24 hours.
Yeah.
It's not all flowing at
Right.
the same time.
This one is
No,
short-term
it's-
acting, and this one does. Like when I eat, I give it just for that, but the long-term acting is released slowly over the course
Yeah,
of the
and you
day.
can actually take both. I sometimes take long-acting insulin on top of my pump because my pump only holds 180 units, which for me is about 2 days worth. So if I want to extend it, I can drop half of my insulin consumption from my pump by taking long-acting insulin. and that's called poly, which is fancy.
So research shows that among adolescents with type 1 diabetes, the rate of depression can be as high as 35%, twice as high as among adolescents who don't have type 1 diabetes.
And I think that's highly dependent on your support structure.
I mean, also that age group you're around, your peers aren't very nice at that age.
Yeah.
So just
Kids are
having people
assholes.
judging you and being mean about it, I would think that would be a very big factor.
Yeah,
That
and-
anyone different is usually going to get made fun of at that age.
And the diagnosis rate is about 1 in 500 or 600 kids, which is in some areas an entire school. So we see a lot of kids who are the only diabetic at their school or in their county or their country, wherever they come from. They don't know, like they've never met another type 1 diabetic.
Yeah, like I was from a big school, Lassiter High School, and I had met other type 1 diabetics, but I didn't really know them. I didn't know anything about the disease.
Yeah.
And also, I would think your support structure. I mean, what are your parents like? How do they react to it? Are they making you feel bad because it's costing all this extra money? So I think those factors would definitely go into it.
And camp has a lot of, I'm going to plug it again, but we have a lot of, there's a very strong social network. There's kind of, I have my friends and then I have my diabetic
So I was
friends.
gonna ask, is it nice being around other diabetic people that were
It's-
like you totally get
It's
what
very, yeah. I mean,
You're the first diabetic I've actually really hung out
you're
with.
coming to camp and you're meeting like 300 other people and they're going to be friends. But
But I
it's nice. It's a really big connection. I mean, I've sat next to people on airplanes and just blabbered about living with type 1 for 45 minutes and feel like really friends just because
Yeah. I mean,
it's kind of a brothers in arms thing, I guess.
I don't talk about it overly much, but it is just nice. Like you're feeling low and you feel like crap and you don't feel like explaining it to someone.
Yeah, you don't
Well,
have
it's
to
just like,
explain.
I'm low.
And I'll be like,
You get
do you need me to
Oh, I've
get,
got an apple
do you
juice,
want
here you
apple
go.
juice? Or, yeah, the
So-
other night we were here studying and it was like, oh, okay, it's time to go home and sleep. And my blood sugar had dropped to 50 for whatever reason. And I was like,
oh,
well, I
put
have
some
stuff
in
in
my
my
locker.
car. And she's like, oh, I have apple juice in my. But
Let's see if I can phrase this in its most positive way. And it's not directed toward you guys in personal, your personal lives, but your observations of others, yourself if you want, but maybe drawing some from the camp. Dating relationships become important during this age group, you know. What are some of the more successful things, the more useful strategies you've used to kind of approach those issues? Because they're obviously part of that developmental cycle.
date other
Well,
diabetics. Actually,
I had one ex that told me many people wouldn't date me because of this medical issue.
I drooled on one of my girlfriends.
No, he did not.
Yeah. That was when we broke
Really,
up. That was-
really, yeah. You have to find someone
Did
who's.
you shoot him before or after that?
No, we were breaking up, so I guess that was his final salt in the wound. But
Jeez.
actually,
Yeah.
though, most
can be
of
good
my
and bad.
relationships have been pretty good about it and pretty understanding. Like I had one where when we were just starting to date, my insulin had gone really, really low, my blood sugar had gone really, really low. And you act a little weird when your insulin's really low, so that was kind of embarrassing.
Yeah, I
but-
did that after school one day, and I was like weaving, and I like
Yeah.
leaned up against my girlfriend at the time and like drooled on her a little bit because I was out of it, and I'd already taken food to fix it, but it still takes 15 to 20 to 30 minutes depending on what you ate for it to hit, and then for the symptoms to resolve. So I was on the way to getting better, but I like drooled on her a little bit, and she didn't like that, obviously, but she wasn't understanding on why I did that, and we kind of fought about that. But mostly you need someone who cares, that can kind of give you your space.
And
You
that
sh-
understands
you have to,
what's
like-
going on.
Yeah, they have to understand. They can be a resource in case something goes wrong if they know.
Yeah.
Like if you're out of it and they know how to handle everything, it can be good. I had a
Yeah.
situation
If you
where
live
they
by
didn't know,
yourself, for
which was
instance,
bad.
and-
When is a
Sugar.
good time to
But-
tell?
I mean, it comes up, and
I mean, most of the people I've dated, I've kind of been friends with beforehand, so they've already known. It's not just like, oh, hey, random stranger, like I'm diabetic. So it hasn't
It
really
depends
been
on
a
the
big
person
deal
a
for
lot.
me, to be honest. It's just more educating them, like, hey, if my blood sugar goes low, I act a little weird. This is why. This is what you should do. Because when I have had embarrassing things happen in the past, it's been just because they weren't sure how to react because they didn't know what was going on. Once it was explained, didn't have that problem again. But
I've had several ways I've handled it. Most of the time, I kind of educate them appropriately. There was one girl I dated where I was, for whatever reason, I was not in the sharing and educating kind of mood for whatever 6 months time period I met and started dating. So she was actually very concerned in being able to help. And she's like, what, very, very understanding and like, what, just tell me what to do, like, teach me. And I was just like, I got it. Like, it's fine. I'll deal with it.
which can be bad if you
Which
go
is bad
low, and
because then I went low
insulin.
and
Did you
she
give
wasn't
insulin?
there, but we had like the same friend group and they called her to get help because they figured logically, which she should have been able to help, they could ask her what to do, and she was like, find the blood sugar meter. It's in a black bag or black or blue bag, and it was actually my blood sugar meter was in a black bag that was in a blue bag, so they didn't find it, and we eventually worked it out, but it was like I should tell her how to do it.
From not properly educated, I've had an ex try and give me insulin when I was passed out low.
That's bad.
That's bad. Luckily, he called my mom first and did not, but definitely explaining how to use a glucagon shot is very important, because if you do pass out and you're unconscious and you're low, it's this big, scary, intimidating needle. So that could be, if you're someone dating a diabetic, I would think that's a little intimidating. But
Yeah.
so I usually explain like, hey, if I go low, here's this is where I keep it, this is how you use it.
Yeah.
So
FYI.
when did you go on a pump? Sorry.
Oh, sorry. Yeah, I never answered that. I started 11 months, April 17th, 2005, on my pump.
Well, because like
I
for a
remember.
girl, you have a purse, right? So you can carry like all the stuff. But like as a guy, if you're
I
younger,
carried a purse.
did you just have like a man
I had
bag?
I had a man
That's
purse.
special.
One of those cinch bags. Gone
okay.
through all those. Pretty much always carry. Actually, I went to Germany for a week or two, and I didn't bring a small bag. I just had like my suitcase, and I had to borrow a bag, and they gave me like a literal man purse. It was like a little like hip bag thing, and I just like carried it around because I couldn't handle being emasculated like that. Because in Germany they're like whatever, fashion sense. But
That's one thing. I'm not on a pump. I have one. When I first started trying to use it, though, I was on prednisone at the time, and then the pump stopped working, and my blood sugar went really high, and I ended up in the hospital, so I haven't tried it since. But as a female, like, guys have pockets.
We have
and
pockets,
stuff
we
to
have
like
belts.
clip it on.
girls
when you're
have
trying
bra
to wear,
straps.
like,
Is
or
pretty
a
much
dress, like
all there is.
eye holster for your pump. It's a
Yeah.
little weird. I don't know.
They make things, but they don't. Typically, from
So that's kind
all
of a
my female
social
friends,
issue.
it's basically you hope your breasts are large enough that you can fit your pump
Which
right
most,
here.
Most of us are not that fortunate.
Yeah.
So.
And that's about, and you routing, the fun thing is there's a tube that you have to route through your clothing. If you're not careful when you like
And then it
go
can
to take
get
a shower
pulled
or
off
change
something,
clothes,
or
you'll
kinks.
rip off things if you're not careful. But
So that's been one issue for me, not to mention like if it's summertime and I want to go to the pool, like, oh, here's my sexy pump. Like,
yeah, or your pump site. See, I have,
yeah.
this is a continuous glucose monitor, which is another thing, but
Insurance
you
won't
get
usually
weird
pay
tan
for that.
lines, which is fun.
Well, I don't get many tan lines.
It almost becomes like brace a status symbol.
Yeah, like sometimes there's a cord.
So
all kinds of stuff,
at this
but-
point, you probably feel like you can conquer anything since you manage your diabetes so well. Do you think in
I
terms
don't
of
think it's because, I think it's almost in,
your
despite.
personality too? But
Yeah.
let me ask you this: so when you think in terms of residency programs, you would be considering. Do you think of type 1 diabetes when you think some of the competitive residencies?
Besides what I would do because of it, or
Like, what do you mean? What?
like I guess
So do
diabetes
you
keeping
have
me from doing something.
an
Oh,
idea about?
I don't know. I
Um,
usually get that much more stubborn when I have something fighting against me, so
Yeah,
it makes
I
me
was
just like. I don't think diabetes would be a big hindrance for
Yeah.
residency. I mean, I could see with long surgeries and your blood sugar going up and down, that could be.
It's something
problematic.
you would figure out.
For instance,
I was
neurosurgery.
I was
Yeah.
actually, I guess this is not exactly what you're asking, but I think it'll answer your question. I was a varsity cheerleader in college for 2 years, and just like the time commitment and physical activity and being able to function at very specific times, it's a lot you have to learn. A big thing we teach our kids at camp is whenever you try something new, like alcohol is a big one, or you move or you start doing a new sport or something, you have to learn what your body does. So you have a learning period of 2 or 3 days or 2 or 3 weeks, depending on what you're doing, where you just have to check more often. You have to start
There's only so much planning
making
you
patterns.
can do.
Yeah,
You have
kind
to
of
really
recognize
see how's my
things,
body
but-
reacting to this, how's it going.
And sometimes your
Crisis
endocrinologist helps
management.
with that. Like we had morning workouts at like 5 a.m. and I had class from like 8 to 2, and at like 1 o'clock every day, my blood sugar would just tank. And I called my endocrinologist, or at my next appointment, asked him about that, and I was like, I've started just eating food, and he was like, "What? Well, when do you work out?" And it was like 5 a.m. And he was like, "Oh, well, 8 hours after you work out, your muscles are trying to rebuild themselves, so your blood sugar will tank."
So it's a
Which I
learning
had that
curve.
problem.
So
dropping
so
during
now
the
I know
night.
that, and
Yeah.
so when I
because
work
if
out
you
at
at
night,
then when you're
at
asleep,
2
it'll
a.m.
drop.
you drop, so you have
One
to
of my
take into
son's
account.
friends was diagnosed at age 21. He was coming home from Mayo, where he attended med school, and just felt lousy. And at night he went into DK. His father, also physician, took him to the ER, measured blood sugar. It was around 500. And he was diagnosed with type 1 diabetes. He's wearing pump, and he's an orthopedic surgeon in Florida,
Yeah.
Mayo,
You can-
Jacksonville, where he is completing his residency.
Yeah, it's.
And
I guess
it's
it
different
doesn't
for
specifically.
everyone.
It doesn't keep you from doing certain things. It kind of generally keeps you from doing anything, or you can do everything. There's not much of a. It's not super discriminatory. It's you can either function like we are now, or you can't do anything
Or
at all, like
you're so
breathe
high,
and not drool on
or-
yourself.
Yeah, or you're so
Or
low.
yeah,
So high.
so high. Yeah, that's fun when you're.
When
Talking
everything
to your
just makes you
parents and you're
angry
like,
and frustrated and you want to throw things.
Yeah,
and-
talking about moods.
Yeah, it does
there's a
cause
lot
some mood
of
swings. 'Cause
awareness.
It's either
of,
low or high for me, it seems like. So.
There's like a sweet spot where, like, for me at least, when I've been between like 180 and 260 for 3 to 4 hours, I'll just want to break things. I don't know if
Yeah.
part of my brain is getting overfed or something, but I'll just get,
And concentrating,
with
at least I have
everything.
found when it's really high, is very difficult.
yeah, I fall asleep in class because
But
I'll
then
eat
Yeah,
it's
because
a
you
something.
get so
way, and you
tired.
don't feel like you need to seek a counselor for that.
Not really. It's very, at least to me, it's apparent that it was a result of my blood sugar being.
When I
What
first
it
got
was,
diagnosed, it might have been a good thing, but not now.
Do they offer that as part of the diagnosis? I think maybe you had asked that, but
Not me anyway.
I
But
don't
I was
think
leaving
so.
for
I think it's more of a
college, so-
you watch and see, and it comes with how long you've had it, and there are I hate to. I feel like this is more something you might have experienced firsthand, but secondhand, I've experienced campers who are kind of like teenage girls who are going into high school. There's a lot of insulin does things. It
Oh.
causes you to accumulate fat,
Yeah, weight gain.
weight gain. There's also a very specific thing called
Diabulimia.
diabulimia.
Yeah, which can be dangerous when you get a bunch of diabetic teenage girls together.
Oh, no.
So basically, instead of bulimia is kind of you eat a lot and then you purge it so your body doesn't absorb the nutrition, so you lose weight that way. Diabetic bulimia, you just eat.
Yeah, and you
And then you don't
take
take
your
insulin, so
your
it-
blood sugar keeps going that much higher. You're breaking down more and more fat because you can't get the glucose.
Yeah, ketogenic diets have nothing on DK as far as weight loss.
And you'll find that with anorexics sometimes, that they get high acid levels in their blood because they're breaking down fat, because they're not eating anything. It's the same concept, just on a much more accelerated, dangerous level.
So there's a big pitfall of just it's like, hey, you could.
Sort of like
you could
take
eat,
this
you could
insulin.
manage this really hard thing to do where you have to count all the carbs and you have to take insulin and you have to watch.
And then it's making you gain weight as a teenage girl.
Or you eat what you want, you don't have to take insulin, your body starts burning more fat than it was. Like, what's the downside to that?
that's the thing.
That's the thing, though. I don't understand how, like, I feel like crap if my blood sugar gets
Yeah.
too high. Like, I want to die. I have a headache. I want to go to sleep. I can't function. So I don't know how I know people do that. I'm not sure how they.
You acclimatize to being high all the
Yes.
time, and you start.
Apparently, up to
feeling-
15% of teens don't comply with insulin dosage, so
Well,
they
that doesn't
restrict
surprise
it
me.
Yeah.
in order to control their weight.
Yeah,
Yeah.
you'll have
I mean,
a
if
big
you-
thing we saw when I shadowed a pediatric
Girls-
endocrinologist. I don't know if I said that, but we would have patients where the doctor would have to ask the parents to watch their kids take their insulin because they would, I'm going to go take my insulin, and they'd go to the bathroom and they'd squirt it in the sink.
Yeah.
So the
or
pen
you'll
would
have
get
girls,
lower.
Teenage girls actually mix up sugar and water to have the actual reading that they want, and then test
Oh,
it
and
on their
test,
strip so
yeah.
that they have fake readings.
Or you get your kids, or you get your
Yeah,
friends,
we
you
had a
check
few
your friends'
teenage
blood
girls do that
sugars.
with- when I was shadowing my endocrinologist.
There's things
And I mean,
you
there
do.
is, when you're first diagnosed and you're taking all this excess insulin, especially if they have you on higher doses than you need, there is usually weight gain associated with that. If you're a middle school girl and you're already getting judged for having this new thing, yeah, issues like that are usually going to come up. It's just recognizing them and making sure if you've got a teenage girl that's constantly going into DKA and not
It's really simple. You just tell the girl that the people who are judging her don't matter, and her long-term health is what's important.
right,
And that
but
works
teenage
all.
girl,
That doesn't work
okay,
ever.
sarcasm.
That never ever.
I was like, are you being serious?
No, that's. I mean, if it did, then there wouldn't be a problem. It's
Yeah.
really hard to convince someone that.
It usually is going to take until they've had their first really dangerous DK episode, and even that might not.
Or they start
Some
having
symptoms
symptoms
to it,
of
Yeah,
nephropathy,
like, oh, hey, I can't
or
feel my feet.
I can't see right because my lens is swollen up,
But,
which is extreme. I feel like that doesn't happen
I
often
mean,
at all.
I haven't been around as many diabetics other than shadowing as you have, so.
It's.
But it is a big issue with teenage girls and diabetes. So.
Did you have a question earlier? Did we answer it? That was like an hour ago. I don't know.
Yeah.
But
I was just gonna say if you could like talk through kind of like your daily, like what do you do? Like wake up.
do you want the ideal or what I actually
No,
do?
like what
What
you
you
do.
actually do.
Like what's your like daily routine?
You want to go first, or
Ooh, yes, you
I can go
Well,
first.
It depends. I wake up, I guess, for class, and I usually don't eat breakfast, but I drink coffee, which weirdly enough always spikes my blood sugar. But I'm always running late, so I don't check it right when I wake up unless it's low, in which case then I can't drive to campus and I'm late. But I go to campus, I'll usually check it once I'm there. I don't really like taking my insulin a lot, and I don't like worrying about it, so I find myself just eating less or eating the same thing every day.
and then
so-
you run up your basals.
Yeah, I just will up my long-term shot a tiny bit, and that kind of keeps me at a decent level rather than constantly having to take insulin injections. I don't know, there's not really that much unless it's a strange day. Then if I work out after a class and, I have to monitor it more,
Yeah.
then I go back to campus and study and check it maybe, depending on
Yeah.
how I'm feeling.
One of the biggest enemies to having good control is not being on like a schedule. I know both of us, I think the first
Yeah.
month of med school, we were just like,
The first
We don't know
month
what to
was
do.
awful. Like
It was-
mine went low, and then I slept through the first quiz because I couldn't wake up, and Dr. Bowser showed up at my apartment. That was a little
oh,
intimidating.
jeez.
Yeah.
I didn't hear about that.
Yeah. So that was great.
Dr.
Yeah.
Bowser showed up at
I
her
think
apartment because I guess she knew.
My blood
about it.
sugar.
Wait,
was,
did she know?
She knew.
She knew, right?
Like your
Right.
health.
Yeah, and my
She
blood
was
sugar
worried.
was
I don't
low,
think I
and
told
Yeah.
which was good because it was low. But yeah. So now that I'm on a more steady schedule, it's gotten a lot easier. But
Yeah.
going
least
from
being
I
able
took
to
a year
anticipate
off
things.
before this, so I wasn't really on a schedule, like whatever. So then going to like a high stress schedule and not being used to really checking it all the time.
You basically have to throw out what you were doing
Yeah.
a month ago and just
And
start from
especially
scratch.
with class and stuff, we're going so often that I don't always have time to eat regularly. I was taking a lot more insulin before I started med school because I was lazy and laying around and eating constantly.
Yeah.
Yeah.
So you have to make sure that you change that. There's just a lot of things to think about. And then if you start exercising, then you got to lower your insulin for that.
Do you feel like routine is like
I hate routine, but it is
I
helpful.
hate it when it makes
Makes
my
things
blood
easier.
sugar.
Yeah. So I get up. I'm always like 5 minutes late to class, so I typically grab like a Pop-Tart and something to drink, like a Gatorade
Yeah, I always have
Powerade.
apple juice with me.
and then go to class and I'll eat. And depending on what my blood sugar feels like or what I know it is, I might take some insulin for breakfast, or I might take a lot of insulin for breakfast if I'm high. Then we have class, and then lunch. Lunch, I typically take insulin for lunch.
So do you do it like 30 minutes before, or do you just wait until like lunch?
I wait
Max,
until,
like as I sit
usually
down to
thinking
eat.
about it.
If I'm planning to eat like my mom's fudge is the most delicious thing on the planet. I have to take like twice as much insulin as I normally would, like an hour and a half before, and be going low, and then take insulin, and then slowly nibble on the fudge because it just spikes you, like it just goes up. I don't think it comes down. It just maxes out, and comes back out the bottom. But
Pancakes get me every time.
Oh,
I had
or
waffles this morning.
potato chips are the worst because
Potato chips.
you look on the bag and you see like a serving size of potato chips is 12 chips, and it's like 10 carbs.
Yeah.
You never eat less than 75 carbs of potato chips unless the bag is tiny, like, and you don't measure them out.
A lot of it is you don't really like pre-plan everything you're gonna eat or drink.
Yeah, it's
that,
like I'm hungry.
That's
Or if
one
you're
reason
grazing.
you're constantly fighting high blood sugar. You're not thinking about it like an hour before or 30 minutes before. It's like, oh hey, I'm thirsty. I'm gonna go to a vending machine and get a Coke. Now I'm gonna take my insulin.
Yeah.
So
Or when you're like stress studying and eating, and
your blood sugar's running
Yeah,
high
how does
because
you
that
of
eat
work?
every
stress
10
and
minutes,
cortisol.
you
Yeah.
stack your insulin, and you just get to
Yeah.
where
I'm
like you have
constantly just like
30
2
minutes on
units,
board. Yeah,
2
rage
units.
bolusing. There's a term for it. It's called rage bolusing.
I was
You
not
would do
aware
it
of
like
that.
every how
Which,
often?
Bolusing.
Technically, you shouldn't take it more. You shouldn't
know,
take
every
insulin more than
hour.
like every hour and a half.
I
But
usually
if you're
take
like
small.
500 and it's been 30 minutes and you're going up still,
Then that could mean your
5 more
insulin's
units,
going
and then
bad,
30
too.
more units, 5 more. Yeah, which is the downside because
Yeah.
if the insulin isn't working, you're just delaying when
Which
you would
I've
fix
had
it.
that happen. I've had since these will jam. Sometimes you're not even aware of it. You think it's going in, and
Oh, you're getting
lo
nothing.
and behold, no insulin's coming
I think
out.
you can sue them for that. But
I'm
yeah,
gonna go.
do you have time for that?
No, I got time for that.
Also, chick, I noticed you wear a thing, right? Like a.
Yes.
I've seen those. They have like bracelets and different.
Oh, that's
Yeah.
what it is. I have a bracelet. It's
Okay.
not on right now, but
What
I
is
used to wear bracelets. This is a medical ID, so it says
So like if anyone,
Patrick W. Leffler, type 1 diabetes, date of birth, my parents' phone number. And then this one is a fancy one. I just got it at the beginning of the year, and I put my G or U ID because it might help. The biggest reason I do that is because for some reason, if you put this down somewhere, it'll, like, someone will take it, and they'll just, like, I swear it's been stolen. Like, it's not like it got left somewhere and I couldn't find it. Like, I've gone back to somewhere and it's gone. And I'm like, why would you steal a medical ID that has someone else's name on it and not call the phone number that's on? I don't know.
I've actually had my bracelet. Yeah.
These things
I've
aren't
had to replace
super
my
cheap,
bracelet.
You have a bracelet, you said?
Yeah, I didn't wear it.
Okay.
Yeah.
It looks kind of like a little charm bracelet. Well, I
Yeah.
thought it did, but every time I wear it, people are like, "Oh, you have a medical ID thing?" I'm like, "Yes."
Some people get tattoos. I've considered.
I've thought
Where
about
do
that
you usually do
actually.
it?
A lot of people get like the wrist or like the shoulder. The shoulder is more not medical alert, but
Right.
you're like, they'll
This is
figure it
most
out.
likely to be seen. Right?
Yeah, there's some studies on whether, like EMS people check tattoos, and almost universally they don't. They'll look at, they're trained to look at medical IDs,
It's
but
kind of an excuse to get a tattoo. Which is
yeah,
sort of what
which
I'm
is
looking for,
basically
so.
what I mean. A lot of my friends have Camp Kudzu tattoos, and I really want one, but I might combine it to justify. But a lot of people who wear pumps just assume that they'll see the pump and they'll go, "Oh, they have type 1 diabetes."
I don't
But
wear a pump, so.
there's also a weird thing where I have a very strong feeling that doctors do not know how to manage emergent type 1 diabetes. They have protocols and stuff, but if you had a race and you had 2 kids with exactly the same level of DKA, I feel, me personally, could fix that kid in 4 hours tops.
Yeah, they don't do that at the hospital.
They'll take
They let
2
you
or 3
just
days.
stay high,
And-
which is the most frustrating thing.
Yeah.
And then my parents freak out at them. Yeah,
I guess there's some potassium concern, but it's...
Yeah, I guess just lowering it slowly enough to make sure you're not overcompensating. I don't know.
Yeah.
Oh,
But
I
it's
know. I
frustrating.
actually did a learning objective.
Oh, you did? Yeah.
Well, correct me if
Sorry.
I'm wrong.
No.
No, not at all. But I heard that if they don't correct it, I was reading an article, and if you don't correct it, taking 48 hours versus 24 hours. If you take longer, you reduce the risk of cerebral edema.
Oh, okay.
Yeah.
And that, like, the cause for the edema is not currently known from, like, the articles I read.
Yeah, I think it's like cytokine something
Okay.
related.
But, yeah, so if you take a little bit longer, instead of, like, boom, fixing it within
Right.
24 hours, if you take 48 hours plus an additional 24 hours using, like, a different injection, then it kind of helps, like,
Yeah.
reduce that risk, is
Yeah.
what I read.
I
The
guess
reason,
just
yeah, the
instantly
reason it
changing acidic
seems
levels.
weird to us is they'll give you a dose or two of insulin during that whole time.
Mm-hmm.
And then your blood
Whereas
sugar
if
still-
we don't go to the like I've been in DKA and not gone to the hospital because as long as you can keep fluid down and you can take and you have access to insulin,
which is difficult though.
you basically self-treat.
Actually, one of the more dangerous things, though, if you're in DKA and you take a bunch of insulin and your insulin or your blood sugar goes low and you can't hold anything down, that's happened to me before, then you're going to have a seizure. And if you're throwing
Just
up
have
with
to write it
DKA,
down.
you can't keep anything down. So
Have you both had seizures?
I haven't had a
You've
seizure,
never had?
I
but
had
I came close
quite
once
a
in China.
few
That was fun.
because I was on a very high long-term insulin dose, and it
Yeah,
was happening
also-
all the time. Which can make, that's another thing, it can kind of, it can give a lot of patients sort of a phobia of insulin because, you're
Yeah,
scared
that's
of
fun.
taking it and going low.
Yeah, no, the last, I don't know, 5 years since undergrad, like having low blood sugar is the absolute worst thing for living for me because I need to be able to drive to school. I need to be able to pay attention to school. I need to be able to take my quizzes. I need to be able to go work out when I was on the cheer team. I needed to be able to literally throw people in the air and catch them.
You
like
even
if I didn't
did
catch them.
that?
Yeah, like it was.
Going
Last
low is a
cheerleader.
lot more difficult. I mean, obviously,
It stops everything.
long-term-
If you're high, you can power through it.
Yeah, but
mostly.
going low is not fun. Actually, some patients like me, they're not exactly sure why this happens, but they'll have a random, just like, I guess, drop in insulin in the night, not drop in insulin, drop in blood sugar in the night, and that'll actually make them more prone to going low with long-term insulin. So they'll usually give you a monitor for like 24, 48 hours to see if your
Tell you
blood
to
sugar is
take a,
constantly doing that.
Was it a high protein, high fat
That and
snack
they'll, like,
at night?
they'll tell you to split up your long term and take like
Oh,
half at
half in the
night
morning,
and
half
half
in the-
maybe in the morning or the
Yeah.
afternoon to keep that from happening. But that can be problematic if you're always waking up with low blood sugar and you can't
Yeah.
drive. And
And you have to take your long acting within. They tell you to take it within an hour of the same time every day. So
yeah, and
typically
if you mess
9 or
that
10
up,
o'clock or 8, 9 or 10 are common times to take your insulin every day
Okay,
for the
sorry,
next-
I'm
for the next 3,000 days.
not, okay, last question, I swear. But so have you guys been to different endocrinologists? Like, how is it seen? I don't know, because I imagine, I'm not sure, but would like some endocrinologists try to put the fear of God into you while others are like,
yeah,
There's
Because if
different
I
styles.
understand,
different people, different different doctors are going to act.
They also
differently.
there's also doctors that like the endocrinologist I shadowed. He had a different attitude for each patient. In general, he was one of the nicer, more understanding. He's been doing it for a while. He basically how he treated his patients was outcome based. And some patients, like for me, he'd be like, "Hey, this is what your problems are," and very non-judgmental. Knowing that I'm an analytical person, he would say, "These are 4 things that are causing you to have not as good control as you need." Other kids, it would be like, he would very much lean on them and say, like, you need to do this. Like, you're not going to be able, especially around teenagers, it would be, we're not going to let you drive. Like, if your blood sugar control is like it is, you will kill someone because you'll go low while you're driving and crash into them. Like, you need to show responsibility in order to be trusted
He was more
with.
paternalistic
Mhm.
because he was an excellent physician who treated the patient, not the
Yeah,
disease.
he also was he started off as a pediatrician. He saw me as an infant for like a week before he went into endocrinology,
Oh, wow.
and then I
Small world.
came back and was his patient again
Yeah.
later. But
I've had some doctors that are more emotional about it, and that doesn't really work as well with me. Like, I don't really want the sympathy and the judgment so much. That's just going to make me resistant and not want to do anything. My endocrinologist is very analytical, just like, here are the facts, here's what you should do, go free.
and there's a weird I know several PAs who have diabetes and some nurse practitioners who have diabetes, and they treat diabetic patients. And coming from, like, if Becca became my endocrinologist somehow, even though she could say the exact same thing in the exact same tone as my current endocrinologist, I'm going to take it differently because she's going to take out some of the stuff that doesn't matter. Like I don't really care if in 50 years my toes are a little tingly. Like that doesn't really bother me. But I've shadowed with patients where it's a 15-year-old boy who's going to high school, and probably the most effective thing you can convince a teenage boy as far as diabetes control is you tell them you're going to not be able to maintain an erection when you're 25 if your blood sugar control continues like this. And it's not necessarily as like a threat, but it's a nice like marker of like, if I continue what I'm doing, this is a direct consequence that will happen fairly soon, and it's just one more reason to be like, okay, I need to change something. Like
you do have to watch though as a doctor how you say that, because I don't like doctors that try and like threaten you and give you scare tactics. Like I had a bunch that were like, oh, well, as a teenage girl, I'm sure you're really worried about scar tissue. If you don't get on a pump and you keep using injections, you're gonna have a buildup of scar tissue, and that's gonna make you look really bad. Well, that just made me very like,
I don't care.
go away. Like,
Yeah.
So.
But like presented in the manner of like, hey, they're like, like we all know, all the diabetics know that there's bad consequences to having high blood sugar, and it's like, well, in addition to like your feet going numb and you're angry and peeing a lot, like stuff's gonna stop working. Like starting with something that isn't probably important to you, like